Good evening and welcome. We are coming to you live from our studios here at Kukumlemle in Accra. We are live on DSTV channel 421, Go TV 125, and around the world on myjoyonline.com. My name is Winston Taki. Coming up on JoyNews Prime, Bawku and environ descend into more chaos as the government says it is moving from peacekeeping to peace enforcement. We have details plus the move by the government to evacuate students from Bawku and AntiIllegal after imposing very strict curfews. Also, Ghana records its first Mpox death. JoyNews checks revealed that the public awareness about the disease remains alarmingly low.
Okay, so I've heard of the Mpox virus, but then I don't really know what it is. And I haven't seen anyone with such illness before.
No, please.
You've never heard about it before?
Yes.
We tell you how to stay safe as cases rise to 257. Also, the National Anti-Illegal Mining Operations Secretariat arrests 11 Chinese nationals in the latest swoop in the Bole-Bamboy enclave of the Savannah region as they renew crackdown on illegal mining. The JoyNews, we are independent, fearless, and credible. Please stay. And now to our first story. The government has transitioned from peacekeeping to peace enforcement in Bawku and surrounding areas following the surge in deadly violence that threatens to unravel months of progress in the fragile peace process. With intensified curfews and a reinforced deployment of the armed forces, the authorities say all necessary steps will be taken to protect lives and property as they call for public cooperation and commends traditional leaders, including Otumfuo Osei II, for their mediation effort. This action has been necessitated as a result of two separate deadly attacks on students in AntiIllegal and Bawku, which has escalated into targeted violence in schools in the region. Last night, two students of AntiIllegal Senior High School were reportedly gunned down by unknown assailants hours after a 19-year-old student of Bawku Senior High School was dragged out of his dormitory and shot dead on campus. The Bawku student, believed to be of Moshi descent, is suspected to have been mistaken for a target in a chieftaincy conflict. Reports indicate that unknown gunmen scaled the school's wall to carry out the attack. Residents have reported sustained gunfire in Bawku over the past 48 hours, with fears growing that the violence is spreading beyond traditional lines and into educational institutions. Parliamentary and Legal Affairs correspondent Kweku Asante joins me via Zoom with a government statement on peace enforcement and curfew imposition in the AntiIllegal township. Kweku, let's begin with a statement on shift in strategy to deal with the protracted Bawku conflict. What is in there?
Well, according to Felix Tsukwachi, the Minister for Government Communication, who put out this statement, over the past few years since this conflict has been raging on in Bawku, the government has been focusing on peacekeeping. But now that is going to be in the past. What they are going to do is to enforce the peace. And so the military strategy is going to change. And according to that statement, a number of military personnel have now been deployed to Bawku and its environment, Bawku and AntiIllegal, and all the flash points in that hotspot. And they say that the shift is going to change. In that statement, Felix Tsukwachi actually says that there are so many people who are peace-loving people who may be affected by this shift in the security arrangement, but they have to do that in the national interest. And that is why the military are going to go in there. Of course, in the coming days, we'll get to know what exactly this shift entails. What does it mean to shift from peacekeeping to peace enforcement? Will that mean the order or the chain of command and certain instructions given to military officials will change or not? We'll get to know that in the coming days. So that is exactly what the government is talking about when it comes to this new shift in approach from peacekeeping to peace enforcement.
Thank you, Kweku Asante, for giving us that detail. Meanwhile, security analyst Adib Sani is urging systematic and structural approach to resolving the Bawku conflict.
There are a number of strategies that can be deployed. We have immediate short, medium to long-term strategy. I do know that this administration is very committed to dealing with the impasse. I remember Bawku was the president's first official trip outside of Accra after he was inaugurated, obviously indicative of the importance he attaches to resolving the matter. But first things first, we need to stop the belligerence. The firing has been reported, almost on hourly basis. I get up-to-date information from people I know on the ground. Sometimes it gets a bit out of control and they fire unabated for, a number of hours or even days. We need to stop it. We need to put more, in my opinion, boots on the ground, enhance intelligence. Then now we can deal with the other issues. The O24 is looking into the matter. Hopefully, very soon, we would have his report, which the government is supposed to look at and probably implement. But going forward, we need to address those systemic, structural, socioeconomic issues that also facilitate the fighting. Issues of youth unemployment would need to be looked at. Proliferation of small arms and light weapons. Issues of law enforcement, because it almost looks like I do you, you do me, which in my opinion is tantamount to a state of lawlessness. I do know the government is committed, but cannot do it alone. We all have a very important role to play. I've always stated that, look, this conflict is a multi-pronged conflict that requires a multi-pronged approach to dealing with. Even the media, you also have a role to play. So, for instance, if one tribe kills another tribe, you don't come out to, clearly state that this tribe has killed that tribe. No, someone is dead.
Now, away from Bawku, Ghana has confirmed its first death from the ongoing Mpox outbreak as health officials report a continued rise in infections. According to the Ghana Health Service, 23 new cases have been recorded, bringing the total number of confirmed infections to 257. Mpox, formerly known as monkeypox, is a viral disease that spreads primarily through close contact with an infected person, including skin-to-skin contact, body fluids, and respiratory droplets. But what do people know about the disease?
Yes, I've heard something about Mpox.
Okay, and are you aware of how it's like?
Something small. Yes, something small. I think it affects the skin, and also I think it is airborne, so it can be transmitted from one person to another if precautions are not taken.
Okay, now you are supposed to make sure that there's social distancing to make sure that you don't get the virus. But currently, I see you in a public transport right now. Are these rules being enforced, or personally, are you making sure that you are making sure there's social distancing?
Okay, personally, I'm making sure that these things are being taken into consideration. But if, like, being in a public transport, the drivers, if you tell them, since they are very much interested in their monies and everything, they don't even want to reserve seats in order to ensure social distancing. But I'll urge passengers to also, like we are saying, washing our hands, making sure that we do things right so that we don't get such viruses.
You've never heard of it?
I don't know exactly what it is, but I've heard the name before.
I have no idea about it.
This is your first time hearing about it?
Okay, so I've heard of the Mpox virus, but then I don't really know what it is. And I haven't seen anyone with such illness before.
No, please.
You've never heard about it before?
Yes.
Here is the current data as of July 22nd, giving you on what is really happening from the Ghana Health Service in terms of data that has been presented. It reflects that so far 23 new confirmed cases have been reported with 1 death, and you can see that total confirmed cases is 257, with one death that has been reported. So far on admission, there has been 0 admission, reflecting and also there's strong sensitization to that effect. Now, here is how to protect yourself. The Ghana Health Service is urging the public to take extra precautions. First, avoid close contact with people showing symptoms. Wash hands frequently with soap and water or use hand sanitizer. And most importantly, report symptoms like fever, rashes or swollen lymph nodes near to the nearest health facility. Health officials say early detection and responsible behavior are critical in preventing further spread. Stay with us for continuing updates on Mpox here on Joy News. In another development, the Society of Medical Laboratory Managers is urging the Ghana Health Service and relevant stakeholders to integrate laboratory managers into core decision-making structures within the health sector. Speaking at the Society's 4th annual general meeting held in Ho, President Dr. Eric Adu emphasized that the exclusion of laboratory professionals from management-level decisions limits the contribution of critical technical expertise necessary for effective healthcare delivery. There is more in this report.
Teamed medical laboratory managers involved in core management, a necessity in restructuring health delivery in Ghana, brought together delegates from medical laboratories across various sectors of the health system. The meeting served as a platform to re-imagine the role of laboratory professionals, strengthen their leadership capacity, advocate for the inclusion in health sector reforms, exchange innovative ideas, and foster stronger professional network. Speaking to the media on the sidelines of the event, Dr. Edu reiterated the urgent need to recognize the pivotal role laboratory managers play in healthcare delivery and urged the government to provide them with a seat at the management table.
The lab plays a very key role in the healthcare delivery system. So we say that the lab is the doctor's doctor because we need to investigate and then come out with the diagnosis and then prognosis that can help the doctor also treat patients and all that. And we work, and then even some medicine say that it is the lab that generates enough funds for the hospital to thrive on. And so if you have a department that is generating enough money for the whole hospital to thrive on, it is important that they are added to the core decision makers. I mean, we work and we generate the money, so decisions cannot be taken on our behalf. All that we are asking is that we want the lab manager at least to be part of the core management of the various facilities. It helps in letting the facilities run very efficiently. If we are involved in the core management and we take some decisions, and it goes a long way to even help the hospital. That is all that we are asking for.
Addressing the gathering, Dr. Lawrence Ofori-Boadu, Deputy Director in charge of clinical care, acknowledged the vital role played by laboratories during COVID-19 pandemic and other health crises. He called for structural inclusion of laboratory managers and health governance.
So many of your members were very instrumental during COVID-19 pandemic. During our outbreaks, we are fighting as a service cholera, Lassa fever, and currently Mpox. These contributions must be recognized through structural inclusion in our governance structure at the operational level. I add my point to the call for dialogue, and that's very important. Call for dialogue and reforms that reflects the modern day healthcare management. Let us broaden our vision of healthcare leadership to include all pillars: clinical, pharmaceutical, nursing, public health, and diagnosis.
The National Anti-Illegal Mining Operations Secretariat, NADMOS, has arrested at least 11 Chinese nationals for engaging in illegal mining activities in the Bole Bamboy enclave of the Savannah region. The arrest is part of a sustained nationwide crackdown on Galamsey, also led to the seizure of several earth-moving equipment tipper trucks, and other materials being used in the illicit operations. The suspects were picked up during a raid on July 24, 2025, with all confiscated items now transported to the National Anti-Illegal Mining Operations Secretariat headquarters in Accra for further action. Authorities say the swoops are ongoing as they intensify efforts to protect the country's natural resources. Meanwhile, the second mini clinic of the EcoBank JoyNews Habitat Fair is still ongoing at the EcoBank head office at the Tema Community 7 traffic light, where you are on the market for your dream home. To upgrade your doors with the latest in the smart security, or curious about making the switch to electric vehicles, the Habitat Fair is one-stop shop. Exhibitors are giving huge discount. Head now to the EcoBank JoyNews Habitat Fair mini clinic, which is happening at the EcoBank office at the Tema Community 7 traffic light.
This has always been that every year your landlord will increase price, whether you like it or not, and the lack of proper rent control to deal with the idea of having to cough up 2 years or 1 year advance doesn't just make sense. So it's pushing most of us to consider building for our own. Difficulty has always been, how do I get all these people at the same time? You have cement, you have sanitary, you have doors, and you have roofing. So when I heard there was a habitat fair organized by Joy and EcoBank, I couldn't have waited longer, especially when it is in Tema. As I've come here, I found a solution to the things I've been searching for. As you can see, I have a lot of brochures, which has actually answered my problem. I'm just going to be calling and getting my product delivered. I couldn't have had a better reason than this.
The rent is escalating day in and day out. You know, the homeowners or the landlords and landladies keep on increasing the rent almost every year. Some can increase as high as 100 cities, some even as high as 1,000 cities every year. Yeah, and I also think the government is not doing well by regulating the rent. Rent control is not doing their best at all, because a few years back we've been hearing people complaining and all that, making noise about the high cost of rent in Ghana and all that. So I think the government should really step up and really control the rent. If paying rent monthly is the best, I think it should be done. If it's yearly, it should be done. Because Charlie, the thing is really eating us up. We the young ones going, working, trying to build a family and all that. We are really suffering, especially in Accra. Rent is so high.
Rent issue is not regulated well. Nowadays, things are very expensive, and landlords are taking advantage over a lot of, let's say, those who don't have the money to buy houses. So I think the government has to do something about it so that everything will be a bit easy and affordable for the normal people to rent or buy a house.
Later at 8 p.m., Carlos Coloni will be on both radio and TV with The Probe. Tonight for discussion, the topic is Ghana's rent crisis, the pain of rent seekers amid official silence and middlemen's power. Carlos joins us via Zoom on what to expect on The Probe. Hello, Carlos. Over the past 2 weeks on Joy News, we've brought our viewers a series of stories highlighting the struggles of rent seekers in Ghana. Before we dive into what to expect on your show tonight, walk us through some of the key challenges faced by rent seekers.
Well, Winston, you know, like you rightly said, tonight we'll be discussing the challenges faced by tenants and rent seekers in the face of increasing housing deficits in the country, which we are told stands at some 1.8 million housing units. And indeed, because of that deficit, homeowners and some agents are taking advantage of the situation and are actually charging tenant and home seekers exorbitant fees and all that. And in some cases, you know, rent seekers get swindled And in some of the features we've done, we've seen where some rent seekers were swindled, and some tenants actually would have to pair themselves up in room, some to about 3 or 4, just to be able to pay these exorbitant rent. And so we'll be looking at that, and also looking at the rent regime we have as a country from 1960s up to now. It appears that regulation of the sector appears not to be working well. And so we'll be looking at some of these things, and also hear from tenants and some rent seekers to really appreciate their concern when it comes to rent.
Who are your guests for tonight's show? Surely our viewers are waiting.
Well, tonight we'll be speaking to Madam Victoria Osei-Sampa. He is the founder and CEO of Ghana Real Estate Professional Association that we call the GREPA. She'll be joining the show all the way from the United States. And we'll also be speaking to Mr. Emmanuel Hovek-Kwasu. He is the head of, actually PRO of the Rent Control Department. And also, we'll also hear from Frederick Opoku. He's the General Secretary of the National Tenant Union of Ghana. So it's looking forward to the show. We are also expecting the sector minister, who is likely to join the conversation, and we'll be asking him some questions, especially what the NDC government seeks to do to address the concerns of tenant and rent seekers.
You also spoke to some people at the EcoBank JoyNews Habitat Fair mini clinic that happened over the weekend. What did they tell you about the rent challenges, especially the patrons who came by?
Well, they are excited that JoyNews is providing the platform where they can come to a one-stop shop to get all that they need to address their rent concerns. But they also spoke heavily about the regulation of the sector, which they think that over the years, government has not done enough to regulate the space, which is making it possible for homeowners and agents to actually take advantage and charge anyhow. So, but they are excited that JoyNews is actually solving that challenge. And they were in Tema. Many of them were happy that they got to the Habitat Fair, and they were able to reach out to all the players in the sector to one place to address their concerns.
Thank you very much, Carlos Caloni. Expect the probe to be coming off this evening at 8 p.m., where the conversation will certainly be centered on rent. Now, from rent, let's move to more on health. There is hope for breast cancer patients as researchers develop manuals to help navigate the painful process of treating and managing breast cancer. The manual, written by a team of researchers including Dr. Evelyn Jiage, has been lauded by MPs and civil society actors as a game changer. There is more in this report.
There is renewed hope for breast cancer patients across the country as researchers have developed a practical manual designed to help patients and their families navigate the often painful and confusing process of managing and treating breast cancer.
Studying breast cancers in women with African ancestry, not just Ghanaians, but across Africa, and anyone who has African ancestry, in order to find new and improved treatments and modalities for treating breast cancer. The breast patient education manual is something that we have been conceiving for years. We wanted to create a book that gives a breast cancer patient all the information that they need, right from detection, screening and detection, all the way to survivorship. Very often you come across patients when they are diagnosed with breast cancer, they believe it's a death sentence. This is because of all the myth that we have heard about breast cancer over the years.
The manual, developed by a team including Dr. Evelyn Jiage, responds to the pressing need, the widespread misinformation that leads many patients down dangerous paths.
There are so many competing factors. When someone is diagnosed with breast cancer, they go to the hospital, they go to the spiritualists, they go to the herbalists, they have to go and pray. There are so many things that they do. And they seek knowledge and advice from so many sources. But we wanted to have a document that is has the correct information. So it is concise, it is accurate, and it has every information that the patient needs. It is easy to understand, it is culturally relevant, and it is in a way that any patient can have access to.
From clinical advice to emotional support, the manual is packed with relevant content.
It gives information on what breast cancer is and what the symptoms are, what to look out for. It provides information on early detection and self-examination techniques that you can do in your own closet to know whether what you are feeling is something like that or not. It provides information on diagnosis, treatments, various options that are available, and the side effects of management.
The initiative has already caught the attention of some members of parliament.
For me, as a vice chair for Population Caucus in Parliament, I'm very, very happy to be part of this launch because the cancer, the disease affects a population. And then this book have aspect of teachings, aspect of educating. You can use it to educate people in your various communities. So I urge every MP to get a copy of this book.
With this manual, researchers hope to empower breast cancer patients with the knowledge and confidence to seek the right care at the right time and survive. This appears to be an important step towards the fight against breast cancer and a reminder that sometimes the most powerful tool in medicine is knowledge.
There are growing calls for the government to increase budgetary allocation to cater for the welfare of widows and their dependents as inequalities rise. Despite social interventions like LEAP, widows and other vulnerable groups continue to suffer poverty and other hardships. At the 2025 edition of the annual Heroes of Ahafo Region Conference, stakeholders demand immediate action. Our Ahafo Regional correspondent Emmanuel Edujemfi has more.
The 2025 edition of the Heroes of the Ahafo Region Conference and Awards, held at Goso by the Widows Connect Africa, a non-governmental organization, aims at supporting vulnerable and marginalized widows across Africa. Prince Jesse Bereche Entry is the executive director of Widows Connect Africa. He has been advocating for a better life for widows.
It's a must. It shouldn't be like people out of benevolence should meet widows and their children and try to support them in a way or the other. No, the nation must enact laws that will stipulate categorically that every widow and their children who are very vulnerable with a proof of their vulnerability stand to gain a certain token at every end of the month. Again, educational challenge must be taken care of by the nation. Just like we have a scheme whereby Cocoa Board is supporting cocoa farmers and their children education.
In addition, he professed a possible solution to mitigating the worsening conditions of widows in Ghana.
What we must do, to me, is that we should first of all set up these people with income-making ventures so that they won't rely on the nation every year or every month for a livelihood support, which is just a token that cannot even sustain the household throughout the month. But we should take a deliberate attempt, or we should make deliberate effort to set these people out with businesses under keen supervision so that they will not also waste the resources of the nation. So once the business starts booming, I think they will not always come back to the nation and looking for an end of month stipend.
A total of 40 personalities who have distinguished themselves in academia, politics, entrepreneurship, medicine, local government, and community empowerment, among other spheres of society, receive recognition.
That's all for the news here on News Prime. My name is Winston Taki. Thanks for watching. Enjoy the rest of our programs. Bye-bye.